Connect Care Network. This is Consumers Doctor, Dr. Bengala. This is a routine thing for me. This is for morning breakfast time. Normally, I want to give few pep talks, you may call it, and something to do in relation to the healthcare. Today's topic, let's talk about risk pool. What is the risk pool? What is an insurance company? Insurance company normally does business basing on your risks. Person's risk. Suppose you have an auto insurance or you have a home insurance. Basing on your profile, they give you the premiums. It makes perfect sense to have a premium based on your risks. I'm sure all of you agree that you want to lower the risk by going to the you know classes, and you get credits. If you attend classes, you get credits. If you're a driver, you've had several tickets, you want to lower your premiums, you go to the AAA classes and your premiums are lowered. This is how the health insurance also works, but right now you're not getting credits for whatever you do because your risk. Would you like to share your risk with 320 million out there? Would you do that? Your premiums right now, your premiums are based on your risks. This is how it is. So that's why. And also, your premiums are based on uncompensated care everywhere, all the hospitals. If a hospital is providing you the uncompensated care, so-called, there's a provision called EMTALA, which is by the is a federal regulations. Anyone who goes through the emergency room, and if you're not insured, they have to they are mandated to provide the care. So what the hospitals do is they provide the care, but it's not compensated for that care. So what happens? Hospital cost goes up. The only way they can recoup the cost by billing the insurance companies, and indirectly insurance companies premiums keeps rising they're because you're exposed. Your insurance premiums are based on 320 million people, and also your premiums are based on 20 and 28 million uninsured. That's what your premiums are based on. This is this is not right. We need to strategize. We need to strategize what your risk is and how much premium to pay. Folks, this is, again, healthcare is when you receive the care. That's what the healthcare is all about. When it's talking about health insurance, how to pay for it, you're financing so you're basically financing by paying your premium. So how are the premiums based on? They're based on a lot of factors, folks. Based on 320 million folks out there. If they are exposed to all the, you have people with chronic illnesses, people with disabilities, people who are impaired, people who are smoking, people with hypertension, you are paying for these. You are paying. How would you like that? You want to pay for everybody else's risk? This is the fundamental aspect. I don't know why people can't grasp it. I'm still trying to figure out why people cannot grasp. You're sharing the risk with everyone out there. I don't like that. I don't like sharing the risk with uninsured, impaired, chronic illnesses, with hypertension, diabetes, you're paying for it. I'm not kidding. You're paying for everybody else. If there are smokers, you're druggies, you're paying for it. Your premiums are based on that. What this Affordable Care Act is doing is basically they're saying, oh, where government is going to subsidize. But when they do that, the insurance premiums keeps going higher because you are paying for everybody else. So the insurance companies, they work no matter how much government subsidizes. So what the Obamacare is giving is that they're giving lower your premiums, and once you lower the premiums, the government are subsidizing your premiums. But the rest of the folks out there who are on the private health insurance, sorry guys, rest of the guys out there are rest of the folks out there are on so-called private insurance, 160 million private insurance folks, and their premiums go because once the government subsidizes to everyone, and it has to be for everyone. So what will happen ultimately? Your cost keeps rising and rising because you have no you have no choice. You don't have any control. You have ultimately bureaucrats control your premiums, how much to pay, and they're telling you, mandating you to have insurance. Bureaucrats are telling you how much to pay, and they're mandating you to pay, and they're raising your taxes. That's what it's going to happen. What I see is that's not right. Everybody. So what I'm going to talk about is risk pool. When you say the risk pool has to be segmented, folks, there's no other choice. If 88% of the folks are healthy, why should I pay for somebody else's risk? But government wants you to pay because what they're doing is they're mandating you, and they're giving the risk of everybody else, and sharing the cost with everybody else. How does that work? If you want to have an individual freedom in healthcare, you really need to segment the risk. When I say the segmentation, this is what I'm talking about. You need to have a personalized healthcare. How do you achieve the personalized healthcare? One thing Affordable Care Act did is 5 things. Number one, guaranteed health insurance. We need to embrace that. In personalized healthcare, I'm talking about guaranteed health insurance. And number two, coverage for the pre-existing illness. We need to embrace that. These are the good things from the Affordable Care Act. I would like to embrace all of these things in the personalized healthcare. And number three, transition from your parental to the individual. Age 26 should not be a problem. And number four, unlimited lifetime maximum. You have to have a coverage for unlimited lifetime maximum. And number five, comprehensive major medical coverage. All these elements, they don't need to be shared. They need to be segmented, folks. Risk needs to be segmented to the individual person, not to the share with everyone else. This is what there are people out there with a lot of chronic illnesses that needs to be segmented for the healthy folks that have chronic illnesses or a catastrophic condition. People are at risk. Why do you want to share your premiums based on everybody else's problems? That's one thing I don't understand. This representatives, when they talk about Obamacare, you are sharing with everybody. They are putting you with everyone. That is not right. If I want to see my own doctor, if I want to see my own go to my own facility, you should have a choice. You should have a freedom. You should have a freedom. Come on, folks. This so-called Obamacare is just not practical. Again, we'll be debating a lot more. I don't want to get into controversies of, you know, Democrats versus Republicans. This is not a political thing. This is something to do with individual freedom in healthcare. Everybody wants to have a freedom. We want to see a doctor whom you like. You want to go to a place you want to go. You want to have the test, and you want to pay for it. It's achievable, folks. It is achievable. It's very simple. If you're really looking at this, called hdhphsa.com, it's health disclosure and healthcare premium with health solutions advantage is a solution to HDHP is a actually it's a high deductible plan, but I renamed it as health disclosure. Your premiums are based on your health disclosure, healthy pricing, and healthy premium, along with HSA, Health Solutions Act, and you put money aside, whatever you're saving from your premium into your health savings. It's a simple concept, and people need to get, and this is yours to keep for the rest of your life, and you have the guaranteed insurance for the rest of your life. You don't have to go to the underwriter. So let me talk about this risk segmentation. There are 4 risks. The premiums have to be based on the risk. It's number 1, catastrophic illness. If somebody has a catastrophic illness, your claims are based on the catastrophic illness. You have an accident, you have something happens, and so you need to have a catastrophic coverage for all the folks, but you don't need to be shared. That's what I'm trying to tell you. It needs to be segmented to the individual. If I'm exposed, if I'm a pilot, if I'm a risky driver, my payments are based on at risk for me, not everybody else out there. That's number 1. And number 2, this is what at risk. If you're exposed to at risk, the 20% of the folks are at risk in the entire population. The people who have smokers, who have hypertension, you have diabetes. They need early intervention, folks. The claims are roughly 20%. People are exposed to at risk. People are at risk for the heart attacks, whatever. They need early intervention. That's what it is. You really need to focus. And your premiums are based and at risk, not with healthy folks out there. Healthy folks should have a lower premium. And number 3, chronic ailments, chronic illnesses. 16% of the population have chronic illnesses. Like, everything, chronic illnesses, you're talking about diabetes, hypertension, congestive heart failure, asthma, arthritis. You are talking about all the 16%, and they have 41% of the claims. How about sharing that risk with well group? It's not right. Your premium, these folks out here, 16% of them with chronic illness, their premiums can be lower with technology, telehealth, telemedicine. And they can avoid the costs what they're incurring right now with chronic. As I said, they also need early intervention. They need more focus. This is where the government has to step in and try to give some type of help to these folks. They can get a certificate of guarantee. If they are rejected by the insurance companies, government has to intervene. It's not the government. What I'm saying is Health Review Board, which is a public-private partnership, has to provide a certificate of guaranteed coverage. That's when the federal or state agencies has to fund it to cover these folks. The last but not the least is Well category. These are the majority of the folks out there. 63% of the population are in the well category. And their claims are less than 1%. It's 12%, but it comes to less than 1%. So your premiums have to be lower for these folks. For an average individual, they should be able to put money aside $300 a month, or $3,600, or 30, actually it's 3,800 every year, into the health solutions, HSA, health solutions advantage. And a family of four, they can put money aside. Their premiums are, because they are in the healthy care. Even one family member has chronic illness, they can get a certificate out. But the rest of the family doesn't need, the premiums have to be lower, because as long as one member gets certificate of guaranteed coverage, the rest of the family premiums are lower, so they can put money aside. It's almost like $700 a month, which comes to almost like $8,400 every year. You can put money aside that is in your account. You can open an account at Fidelity and fund it. Fidelity has an HSA, and several brokerage firms out there have an HSA. You can fund that, and you control, and they are invested. The whatever the returns you get, average return is 8 to 10%, folks. And if you're in the mutual funds or index funds, don't buy individual stocks. They are very safe. It's tied to the market, and it grows over, and they're not taxable. The beauty about is HSA, Health Solutions Advantage, is they're not taxable. This contribution is before taxes. You can write it off from your taxes, and the returns on your investment are not taxable, and withdrawals are not taxable. This is a beauty. Everybody should embrace that. And irrespective of so-called Affordable Care Act, I'm talking about the rest of the folks out there on the private health insurance. I wish even the Medicare, revamps the bureaucracy what we have in the Medicare. Medicare is spending tons of money on the intermediary organization. I wish they give the money to the Americans. They can buy it. I can do the same thing individually if I'm the AARP member, if I'm a senior, if I have a Medicare, I'm getting the Social Security, but they're wasting my $1,200 every month into the intermediary organization, and they're restricting the care. This is what they're being bombarded with, all this Medicare Advantage, this, Medicare that. They want the federal dollars, and they're getting it. I wish government wakes up and they give me that $1,200. I will go and buy low, health disclosure healthy premium, which HTHP account, lower the premium to $500-600. I can put money aside even as a senior. I That will be a blessing in disguise. I can handle my own healthcare. I don't want somebody to tell me you can't see this doctor, you cannot go to this place, you cannot get this medication. I don't want anybody to tell me how to handle my health. That's none of their business. This is my body. This is my asset. I want to take care of it. ARP, if you're listening, CMS, Center for Medicare, if you're listening, you're wasting that money on intermediary organizations like billing companies, CPT codes, DR. They're all made up numbers, folks. These are not the right numbers. CPT, DRG's codes are cooked up by the bureaucrats. They have cooked up all these numbers without any consumer's input. I don't want billing companies ripping me off. Surprise medical bill. I don't want billing companies on my back. And people are declaring bankruptcy because they just can't afford this surprise medical billing. I want to pay as I go. Give me that $1,200. I will put money aside into my. Initially, government has to help, and people. This is what the beauty is. I want people who are 15 to 20% are not economically afford it to buy insurance. This is where you need the attention. Give them incentivize them. This Medicare is a hardwash. Medicaid, nobody wants to take care of the Medicaid patients. No, but none of the doctors want. I got when I billed the Medicaid for 20 patients, they had the audacity to send me a 1 cent check. Why would I take Medicaid as a physician? Physicians don't want to take care of Medicaid. They're not getting the right care. They're not getting the right. This is what they, who are 28 million people out there, you really don't need Medicaid. You don't need HMO. You don't need the managed care. Give them that money and they let them pay for health disclosure, healthy pricing premiums. They can save money. If Americans are given the option to save, they will love to. And they're used for only healthcare. And this so-called Affordable Care Act is a good thing. Let's embrace the Affordable Care Act in certain aspects. What I'm saying is the Healthcare Act is, as I said earlier, guaranteed health coverage. Yes, do it through the HTHPHSA, guaranteed, covering the pre-existing illnesses, transition from individual to the from the family, and unlimited lifetime maximum, and comprehensive. Embrace all that and do it through the HTHP. These representatives needs education, folks. They don't get it. They don't get it. They think is this one size fits all. It doesn't work. You cannot mandate people to go and buy higher premium insurance. Give the money to the invest in Americans. This is what I've been telling. Invest in Americans where they can go and shop and lower their premiums. Give them the it's at the health, like a, if you're talking about a food industry, they're regulated, highly regulated. I want the healthcare in the same category. Amazons have to get into the healthcare. Google has to get into the healthcare business. I want companies to get involved. They have large employers out there. They can get these HTHP, HSA accounts set up for all their employees. You're talking about 200 and 240 million. Even government subsidized folks, Medicare, veterans. Give them the same option. Give them the let them get the HT. But you mandate it. You mandate it. They have to have an HDHP accounts and get them participate in the health solutions advantage, which is an HSA. You mandate that. And in the bottom half, 15 to 20% of the folks out there, give them the life insurance, guaranteed life for 100,000. How much the premium? Government can afford that. Federal and state, they can give the life insurance for poor people out there. They can afford it. The government can provide. Like what I see is everybody should have life insurance if they qualify. 100,000 life insurance, and insurance companies will love to provide insurance for all the folks, people who are economically not stable. Folks, thank you for joining. If you like this channel, subscribe and hit the notification button. I'll continue to talk about personalized healthcare, how it can be done, how it can be achieved. And it is a very simple, folks. And we need to embrace that HTHP HSA, which is health disclosure, healthy pricing, healthy premium with health solutions advantage. That is the solution for personalized healthcare, folks. I'll be talking every day on this subject, and I would like you guys to give me some input, and we need to educate everyone, the congressmen, the senators, and even when it comes to the Washington D.C., even AARP members. We need to educate even the Medicare, CMS, HHS. We need the freedom in healthcare, man. Freedom. That is no other thing as freedom in healthcare. I should be able to go and see my doctor. I should be able to visit my hospital. I don't want to be forced into going anywhere. And my premiums have to be affordable. This is my body and I can take care of it. Thanks again. We'll see you tomorrow at the same time. This is CCN and Consumers Doctor, Dr. Bengala.